Let's discuss our plan for the second stage with fillers, and here my goal will be to highlight masculine and feminine features, because here we can see overall combination of yin and yang features. Let's start with the patient assessment, and now I want to double check your proportions, and I'm starting with your three parts of your face. And according to golden ratio and classical canons, it should be 3 equal parts. And here you can see that the mid face a little bit longer than the upper face. And we just keep it in mind, and we can change a little bit the hairstyle. And now it's more important to measure the mid face and the lower face. And here you can see that the lower face is shorter than the mid face, and it means that the chin is a bit short for her profile. We probably will add a little bit to the chin to improve this length. She presents a little bit flat forehead, prominent glabella and prominent nose, a little bit wide chin. These are preferably male features. And at the same time you can see your big and feminine eyes and soft lips. So it's a great combination. It's like a mixture of male and female features, and it's a great point to determine these features, to realize it, and then to improve this and highlight the advantages. Now I want to show you orbital proportion. You remember that the distance in between the eyes should be the same like one eye width according to golden ratio and classical canons. Have a look on this situation here. This is inter-eye distance from medial canthi to medial canthi. Now I'm comparing it with one eye width, and it's perfect, it's equal. And the same distance like in between the eyes should be the base of the nose and the base of the chin in female faces according to classical canons. But she's Gamin, you remember her body type is a mixture of masculine and feminine features. Let's see the orbitonasal proportion. Again, measure the inter-eye distance and compare with the base of the nose. She presents wider base of the nose, and we just keep it in mind that it can be great to slim the base of the nose with our injections. And now we want to compare inter-eye distance with the base of the chin, and you can see that the base of the chin is wider, also male feature on her face. And probably we will add also to the chin to improve this proportion and to make this the lower face longer. Now guys, I want you to show how to identify the apex of the cheeks, because this is one of the most important beauty point on the face, and with this point you can start your injections with your patients. And how to do this? We need to measure again with the smallest part of calipers. We need to measure inter-eye distance, then draw the line from the alar to tragus, and flip your calipers. This tip will show you exactly where should be the point, and you can see that in my patient is drooping, and we need to lift up this point and make this beautiful definition with our injections. Another simple way of finding this point is to measure again the inter-eye distance. Then again flip your calipers and put it from the medial canthi and adjust it to this 45 degrees direction to this line, and then you will see with this tip exactly where should be the point. And now from the side view I want to show you additional measurement for the lower face. I just want to see the length of the jawline. I put my calipers from the angle of mandibular to the mandibular ligament and then to the central part of the chin, and you can see the same result, that we need to add to the chin to elongate a little bit jawline for the perfect definition and perfect proportion. And I want to see the fullness on the temple area, and it's good. And the position of the eyebrow is also good, and we already improved it with botulinum treatment. And let's summarize the plan. And like discussed, I will start with this apex point. I just want to see again precisely where should be the apex. It should be right here, and I will start from this point. My product of choice today is Allergan's Juvederm, and this point exactly I will inject with Voluma. Не бойся. Хорошо все?
Да.
Done. 0.1, then again here 0.1, and this beautiful definition I split in 3 points, 0.1, 0.1 and 0.1, and you can see that we already have this definition. Great. Now I switch to overlift, and then I will go to this point. You remember where the midcheek groove? Нет, не так вообще. Now I switch to overlift and then go here to support the zygomatic ligament and orbital retaining ligament. And here I want to inject 0.2. That's great. Done. And now I go to the midcheek groove, and here I am injecting on the bone. And also 0.2. And we're done this side. You already can see beautiful definition. We already done apex of the cheeks. We improved this unwanted shadows. We improved this nasal orbital proportion, nasal facial. We improved these proportions. And now I want to go to the chin and add to the central part on the chin. Расслабься, расслабься, расслабься. Нет, да. 0.2, 0.3 cc I add here. Now it's 0.2 and additional point for the chin. And you already can see that the chin becomes slimmer, become more defined, and look on her lower lip. It's become better position of the lower lip. This is additional goal. You remember her rickets line. We need to settle the lower lip. You can look here on her face. It's become better. Her chin become better, longer jawline and slimmer chin and more defined cheeks. And now I want to double check her look to her rickets line. You remember her lower lip was touching the pencil, and now it's ideal. Can you see this gap between pencil and her lip? We improved this proportion and it's great. Let's check again the proportions. Can you see? It's become close to ideal. And also her chin becomes slimmer. And her jawline. Let's double check the jawline. Her jawline becomes ideal. Her profile becomes better. And now I want to double check the apex of the cheeks. Again, measure the distance between the eyes, flip calipers and go to the apex. Can you see? It's here, right here when it should be. Now I will do the same for second side. First measure again the distance between the eyes. Distance between the eyes, and then go here to apex of the cheeks on alar tragus line. It should be here. And I'm injecting right here. To improve this beautiful definition, to create this beautiful definition. The same 0.1, 0.1 and 0.1. Now this second point to support the ligaments, again 0.2, and here to the midface groove. To support this ligament also 0.2. Done. Now I'm going here to the base of the nose under the buccomaxillary ligament. You should go down to the bone. Relax. Расслабься, не бойся. Then you have to do aspiration first. Расслабься. Расслабь. Look guys, here you can see right now you can see positive aspiration test, and you always ask me, does it make sense to make aspiration? Look, I was on the bone, I done my aspiration test, and I was waiting less than 1 minute, and you saw the blood in the syringe. It means that it's positive aspiration, and we have to change the point of injection. And I want to show you another point here. Will give my patient a little bit time. Here is the ligament, buccal maxillary ligament. You just pull the skin with the ligament and go under the ligament right here. And again make aspiration test. Здесь лучше же, да? Make your aspiration. And you can see that it's good here, and we can inject. I'm injecting now. Больно? Молодец, смелая такая. And we're done. Hey guys, I think that this is a very interesting case, and you saw 2 stages of correction. First we done botulinum toxin, and then after 2 weeks we done fillers, and then during fillers procedure you saw the positive aspiration test, and I believe that it's necessary to do aspiration test every time you go in a dangerous area. I wish you good luck and amazing results with your patients, and see you in the next webinar. Thank you for watching.